watching KITV4 Morning News.
A recent Health.com poll says 67% of women are too embarrassed to talk about specific health concerns as they age. Joining us live from New York City is women's health expert Dr. Roshini Raj. Good morning, doctor.
Good morning.
So tell us, what are some of the most embarrassing things women are afraid to ask their doctors?
Sure. Well, I think it depends a little bit on the age of the woman, and with every decade as we age, there are some unique health issues associated with that time period. So women in their 30s often are very focused on their appearance, and some of the questions that come up could be related to that. So one of the things women wear a lot these days are these very tight undergarments or shapewear, and are there any health risks with that? Well, if you are wearing them excessively, several hours a day for many days in a row, you could be creating too much warmth and moisture in that area, which could lead to a yeast infection, for example. Also, if you have irritable bowel syndrome and you tend to get bloated, it can be very uncomfortable to have that tightness around the waist because it can really restrict the movement of your intestine. As we move on to their 40s, women at this point are usually maybe finished having their children, and they're really looking at their bodies and trying to reassess what's happened to their bodies. Of course, they might be concerned about weight gain, but they may also notice that their foot has actually increased in size, so they've actually gone up a shoe size. This is actually a very normal consequence of pregnancy. When we're pregnant, we release a hormone called relaxin, which helps relax our pelvic ligaments, and that allows the baby to go through. But it also, that same hormone will affect other ligaments throughout the body, including in your feet. So you'll notice a widening of your foot perhaps, and perhaps go up a shoe size as well. Then when we move on to the 50s, this is where many women are experiencing menopause, but they also might have some bladder issues. One very common issue is stress incontinence, which involves leakage of urine if they're coughing or laughing or putting any exertion on the abdominal area. But there's another condition called overactive bladder, and I'm excited to be working with Oxytrol for Women today to talk about this condition. It's very common. Women often don't seek treatment for it, but it involves urinary frequency, urgency, and accidents, at least 2 of those 3 symptoms, for several months. And there is now a new over-the-counter treatment option called Oxytrol for Women, which is a clear patch which releases medication that can really help resolve those symptoms.
All right. Well, real quickly, how can women become more educated about their health concerns? What might be one tip?
Sure. Well, I think they should, first of all, talk to their doctor. And you asked for one tip, but I think going online and going to some academic medical center websites like MayoClinic.com can be really helpful. And then, of course, for this condition, OxytrolForWomen.com.
All right, doctor, thanks so much for speaking with us. Great ideas, great advice as well. Thank you.
Thank you for having me. Take care.
And taking notes.
I know. I didn't know about the shapewear.
You know,
those Spanx and all that stuff.
Okay.
Maybe TMI.
All right. Well, all right. Let's take a quick look at traffic.